Okay. Good afternoon, everybody. My name is Cassia Lewis-Land, and I'm going to be presenting some data today from the Department of General Pediatrics and Adolescent Study. We conducted a feasibility study on text messaging parents about their kids with asthma. And so this is a short study. It has about 20 participants in it, and it literally it just happened, meaning the last family just finished their 1-month trial period on Friday. So I have basically an overview of what the study was like and a little bit of data to include. I was in the office like at 6 a.m. this morning trying to get a little bit of data so I could present some things to you guys. We thought about text messaging because, like Dr. Ann said this morning, intervention should be, along with the behavioral framework, should be fun, easy, and popular. And I think that is what text messaging is, and especially to our population. Tell you a little bit about why text messaging is easy, what our project was about. It's called the Asthma Text Project, and we nicknamed it ATP for the parents as an abbreviation, which is pretty simple and easy. And maybe some implications of this research and how we can use it in future ways. So why cell phones? Well, because everybody has them, basically. We all know cell phones are personable. Kids have cell phones today. I mean, like in this study, it was 3 to 10-year-olds, and out of the 20 families, 12 of those kids had cell phones of their own. So that really says a lot. When you're in elementary school and you have a cell phone, that says a lot. So they're portable. They can go with you anywhere. It's like we all know about the asthma diaries. Your cell phone is a perfect asthma diary. It's with you all the time. It can record all your symptoms. It's connected. Most phones today are connected to the internet, so if you have access, you can use social media in this way, and you can also go on other websites. It is also intelligent. Most people that have cell phones today, they're like small PCs. The smartphones are taking over the market. And 95%, these are some statistics I pulled, 95% of all cell phones have text messaging capability. So it's a technology that is out there. Most people can send and receive messages, and everybody can get messages at your own phone. Amazingly, when we started doing this research, we were looking at even countries like Africa. Text messaging interventions have become very, very large in countries like Africa, and even in Haiti with the earthquake there. A lot of foundations use text messaging. I can show you some of the research that help to get information to and from people in those areas, because everybody has a cell phone. So basically, with our project, we linked up with another company. It's called Health Central, and they are a media-based company, and they have a framework that was already developed with another doctor that's a psychologist at Johns Hopkins, and his website is called Mood 24/7, which basically is tracking the health of patients that have a mood disorder. So it texts them every day and asks them how is their mood that day. And they text back, and their clinician can look and see what their mood was that day. So we came up with this idea that why not make it asthma 24/7? So we use the same web framework to just make it an asthma program. So we developed a text message, and with text messaging, your message has to be 160 characters or less to be included in one screen on most people's cell phones. So the message that we developed kind of was just asking the parent, what was your child's asthma score today on a scale of 1 to 10, any symptoms that they observed, and any medications that they gave that day. I mean, we all would like to know different things, like about the kid's environment that day, or like what was the weather about, because as researchers, we like data. So, but with a text messaging project, it was basically just to monitor over a 30-day time span how that child's asthma was doing. And if we saw something alarming, like if the parent reported back that the kid was taking the albuterol every day, then a nurse would call them, and then she would talk to them, and we would get a little bit more data. So in particular, I did a screen of this is exactly how the message looks. So this is about, I think I counted it before we submitted it as maybe like 158 characters. So we just got everything right in. And so on the score, 1 was like the kid was doing really good, and 10 was like if they were going really bad. So we actually put in the text message 1 would be great and 10 would be go to the ER, so parents could have a point of reference. because that was kind of hard. Some people think 10 is like, oh, really good, and 1 is really bad. So every text message every day said the same message, and then the parent was to text back their response along with any symptoms or medications given. This screen is kind of what we did. I did a cue card for all the parents that they could keep in their wallet, or even I made a little sticky that they could put on the back of their cell phone to try to remind them what abbreviations to text back. So when it comes to the asthma score, they will always have to text back with the company. With the company we use, it was really important to text ATP at the front of the message because they use a 5-digit number, and when you text back, all the people that were texting back for mood were also texting back to the same number. So in order to differentiate our asthma patients, they had to text back ATP. So that identified them as our patients, and then it would get sent especially to where we could see on our internet, on a website, their charts for that day. So the abbreviations were like the following, like a C for cough, or W for wheeze, and any of the medications that they were prescribed and that they took that day. Now, as we were going along, a lot of parents let us know anecdotally that it was kind of a reminder for them to give the medicine that day. So when they would get the text message, they're like, oh, I didn't give the kid the Flovent today, come let me take the Flovent. So that was something that we kind of learned on the back end that was more of a reminder than always a self-report that I did it already. This is a screen of how it looked for us. So every day I could go on, and the company, as the person texts back, they would put in a certain dot. So like on February 28th was the first day that kid was enrolled in the study. And then every day it would be a dot of where they are. So you see on the graph 0 and then up to 10. This little boy was really, really well. So you see he had a couple of days where he reported like a 2, and the mom said maybe he was coughing that day, or he had some activities that but he took his controller like every day. So this is an example of a parent that she was honestly the best mom in the study because she responded every day, which not every parent did, but so she's a perfect one. And then also they did like numbers. So they averaged out, if you see at the top, Sundays, Mondays, Tuesdays. So now that the study is over, I can kind of go back and look at an average day to see if there were any days, and that will help because I also can be able to match it up with seasonality to see if it was any changes. Also, what was convenient, so in the occurrence, if a kid had a really high score, which we said was a 5 and above, so any day if a parent texts back that the kid had a score of 5 or above, then the nurse would call and talk to the parent to see what was going on. And so this is like a note of one day when the mom texts back. She texts that he had a 1, but every couple of days we would still check on them, and the nurse put in this short note. And that's what I really liked about the program, because it keeps you from having to write always in a chart. So not only do we have the data in a chart form, but we also have an annotation every day. And you see every day she was really good about giving him his Flovent. And the time and the date stamp is when she actually responded by text message. So it's really like up-to-date program, because when I would enroll parents in their home, I would have them do their first day right with me, and then I would check like literally right with them on the laptop to see that there was their notation from that day. So that's why it's like really good to be up to date. It was like live. So we have a little bit of results that I was able to do for us. 18 out of the 20 were caregivers, and they were 5 to 11-year-olds. I did enroll 2 adolescents in the study just to try to see if there would be a difference in a parent texting back and an adolescent actually texting back themselves. So that's something that we're going to look at. We collected some baseline data, and 80% of the parents said that the kid was on a prescribed controller. 90% of them said that they had unlimited phone plans, because that was of interest to working in this population. I was quite concerned that I didn't want the parents to incur extra costs in participating in the study. But most parents honestly had the unlimited text messaging, so it didn't cost them anything to participate virtually because they were texting already. Most of the phone carriers that were really easy with this project were Boost, Sprint, AT&T, T-Mobile, and Verizon. We had a little bit of problems with Cricket and Cricket seems to be a really popular phone plan with our population. I'm not sure if I told you, it's basically inner city minority families. So a lot of them have Cricket because I think you can get an unlimited plan for pretty cheap, but that plan doesn't accept, this company sends a 5-digit code. So if you see, like when we text message each other, usually it's from a regular phone number, but if you ever watch commercials sometimes and it says text to this 5-digit code to get a free ringtone or something like that, that is like the kind of numbers that this company uses, a 5-digit one, and certain phone services don't allow that. So that was kind of like a lesson learned that we learned again on the back end about certain phone carriers. Another thing that we were a little bit concerned about was our population keeping a steady cell phone for a whole month, because a lot of people frequently lose their cell phone or they lose their minutes and then they have to wait till next month to buy it. But interestingly, out of 20, only 3 people had a cell phone interruption. And I could kind of tell that if after about 3 or 4 days I wasn't getting a response back, then I would call and I would hear like the number was off. Or a lot of moms are really good, they would call me and be like, in a few days my cell phone is not going to be working, can you start texting to another number? And it would maybe be a boyfriend or another caregiver or somebody for the child that we could continue to text, that they would respond back from that number. So the response rate over a weekly response rate was about 3.8. For the total span of time, most people responded for just the average of 20 days. I found that most people didn't respond the most on the weekends, which is also kind of compliant with most people don't take their medicine on the weekends. So most people missed about the protocol that I kind of established was that after 3 missed days, then I would call. Because I didn't want the parents to feel like after one time I'm going to be calling them every other day to say, you didn't respond to a text message, is everything okay? But so I would wait like 3 days and I would call and be like, is everything okay? And then most moms like, yeah, I just have been forgetting to, text back, because at the beginning we kind of asked them, what time would you like your text message? So the parent could opt themselves to say, oh, I want it at 7 a.m. or I want it at 10 p.m. at night. So if they missed a couple of days, then I would like, would you like me to change the time? Maybe, 7 o'clock isn't a good time for you. Maybe you want to try another time of the day. And I think that probably increased the response rate a little bit, because then they could alternate up to a time that was more convenient to them. Again, out of 20 families, we only had 1 kid that over the 1 month period did report an ER visit. And I noticed because the next day when I went on, the mom had like a note that she took the kid to the ER the previous day. So the nurse called and she was able to talk to the family and then to also convey that information back to our clinic, because the kid actually went to the pediatrics clinic that is below us. So we got to talk to the provider about that. So we're going to do some further analysis. Some things that I'm going to be looking at starting tomorrow is the asthma severity level of the kids. Most of the kids, looking at baseline data, were moderate to persistent asthma. I'm going to try to look to see the medication adherence, because I didn't see a lot of controller usage. That's just from me eyeballing the charts every day on the internet. But again, 80% reported that they were prescribed a controller. So I'm also going to look at the response rate per patient and also see if it has any link with socioeconomic status, which is a big one. There were some limitations. It's a convenient sample. Most of the parents had just finished being enrolled in a asthma control and intervention study that we were conducting. So once they had finished that, I then enrolled them in this project. So they had been in an asthma study. It was a small sample size of about 20 people, but looking at the literature review, most of the text messaging studies have been on really small sample sizes. There was a self-report, so I can't validate if, every day if the parent was really reporting that the child was coughing and wheezing or wasn't coughing and wheezing, and entry errors. There was a steep learning curve with some parents, even though they text a lot and they text to their friends, texting back specifically to follow the instructions, it texts back like ATP every single day, and it texts back a number after that, and then the medicine, that was kind of a learning curve for some people. And some parents, like, I would call them and like, I haven't seen anything, like, no, I'm texting back. And then I would call the company and talk to the programmer, and he could see on the back end that maybe they were doing a PT first, and then it wasn't getting to us, so they were texting ATP and not putting down a number, or not listen to medicine. So an entry error is probably one of the big